let me take you back to the times. We're talking now the 50s. And Chicago had about 65 hospitals. There was Powell County, which we felt took overwhelming majority of certainly maternity cases and patients, 6 hospital patients. But the hospital council surprisingly denied all. In hearings or in interviews, they said, we have black patients all the time. We don't even notice that. It was a very big obstacle. Then we had a good idea. This was incidentally the reign of the Committee to End Discrimination in Chicago Medical Institutions. I refused to join any organization that didn't have at least 5 words in its title. But that committee knew what the facts were. We knew from colleagues that they were discouraged from admitting black patients. It's just a clear-cut case, but we couldn't prove it. So we had a good idea. It turns out, you probably all know this, that births and deaths are recorded by race and by, well, not ethnicity, but race and, you know what you put on birth certificate, the cause of death and all the rest. And the hospital is on it. That's, I forgot, I'll soon you forget. So we went, there was a guy who was the commissioner, Bunderson. He was a curmudgeon. He was in the daily administration, which meant he was played the game, but he was very, very clear on public health issues in the good sense. And a maternal death under his watch got extreme examination and correction. So we went to Bunsen, who had an earned reputation for a short temper and not suffering fools, and we said what we wanted. We'd like to get, for the year before, all births and deaths by race and by hospital from your birth certificates in Chicago. He stared at us what looked like a century. It was probably about 15 minutes. He said, okay, 15 seconds. He said, sure. And so he called the lackey in and told him what he wanted. We were sitting there watching. This is the days of the punch cards, not computers. And they put in all the births and deaths in Chicago and they jigger and end up in different slots. And there we saw scientific evidence, vivid, incontrovertible evidence of where people had births and deaths. And no surprise, if you were a black baby born in Chicago, you had about an 80% chance of being born in Cook County, about a 12 or 15% chance of being born at Providence, and the rest were scattered throughout the other 65 hospitals, one here, 2 there, and so on. Cynics suggested that these were black babies smuggled into the emergency room in the womb by their white mothers. And so with deaths, roughly the same ratio. So it was no question that in Chicago in 1952, whatever, that if you were black, you were born in a county or a province, and if you were black, you died in a county or province. And that ended the debate about whether there was discrimination. It was rather remarkable. And that, of course, was incontrovertible scientific evidence. And then, of course, the blame game began. The hospital administrators said their doctors were a bunch of racists and they'd never admit. We tried to have conversations like that went on. But you can say that that ended discrimination, at least in overt discrimination, racial admission.